Imagine you are driving off-road in this rugged all-terrain vehicle. You're hitting every bump, taking sharp turns, just completely barreling through the mud.
Right, feeling like you can just conquer anything.
Exactly.
Mm.
And that is exactly what it feels like to live with a young giant breed dog. I mean, they are seemingly indestructible.
Oh, for sure.
But then one day you look down at your steering wheel and realize you aren't driving an ATV anymore. You're suddenly behind the wheel of this classic vintage luxury car.
Yeah, and the journey hasn't stopped, right? But the ride itself, it requires this entirely different level of nuance and respect.
Yes.
Because you can't just take a vintage car over a speed bump at 40 miles an hour. You'd wreck it.
No, you definitely cannot. And welcome to today's deep dive. We are looking at this incredibly insightful piece of source material from the Bernese Mountain Dog Health Academy.
It's a great resource.
It really is. And today, we are specifically zeroing in on the senior years of this famous giant breed. So for you listening, whether you have a Bernese or maybe another giant breed or honestly just a dog you love, our mission today is to extract the vital insights on how to navigate those golden years.
And we should be clear right up front about this. The material we are diving into, it is not some depressing clinical list of diseases.
Right. Nobody wants to hear that.
Exactly. It is actually a profoundly uplifting guide. It focuses heavily on how the bond with your dog actually deepens as they age. Well, provided you know how to properly support them.
Yeah, and the emotional core of this text is just so vivid. Like, you can really picture this dog that might be a bit slower, maybe sporting a grayer face. Getting off the hardwood floor might look like a carefully calculated maneuver rather than just a simple jump.
Yeah, it takes effort.
But they still have those incredibly soft eyes. And they have the exact same desire to just follow you from room to room. I mean, the spirit is willing, even if the body is asking for a little more help.
It's true. But to provide that help effectively, we have to start by understanding when this transition actually happens. And crucially, we have to look at why this specific breed makes spotting that transition so surprisingly difficult for an owner.
Okay, let's unpack this. When does a Bernese actually become a senior? Because the source explicitly warns us against treating senior as, like, a rigid milestone.
Right? It's not a magic number.
Not a magic number on a calendar.
Fair.
But because they are a giant breed, you do have to build in support much earlier than you would for, say, a tiny terrier.
Yeah, the timeline is just compressed for giant breeds, mostly simply because of the sheer mechanical load on their joints over time. Gravity is not their friend.
Wow.
Yeah. But you hit on a key point there. Assigning a strict chronological age often misleads owners. They end up either panicking way too early or, worse, ignoring subtle signs way too late.
I do have to push back a little here, though. Like, if my dog is still happy, they're social, they're bringing me toys, aren't we jumping the gun by labeling them a senior and treating them differently?
That's a super common reaction.
Because it almost feels like we are prematurely aging them just because of their breed size.
Well, what's fascinating here is that senior care is not a label of decline. That is purely a human projection. We put that on the word senior.
Interesting.
In the context of this source material, senior is simply a shift in how closely you observe your dog. You aren't changing their identity, you are just upgrading your level of observation.
Upgrading observation. I like that.
And for the Bernese Mountain Dog, that observation needs to be incredibly sharp because of a very specific breed trait. They are remarkably stoic.
Right. The famous gentle giant persona.
Exactly. But that gentle giant persona is actually a double-edged sword. You have to remember, historically, these were draft dogs in the Swiss Alps.
They were bred to pull carts, right?
Right. They were bred to pull carts and work hard. A dog that stops working over every minor ache, well, that just wasn't useful on a farm. So that genetic stoicism completely persists today.
Oh, wow.
They are so eager to please that they can, and they absolutely will hide genuine discomfort. A Bernese will still wag its tail, it'll eat dinner with enthusiasm, and it'll follow you into the kitchen even when they are navigating significant pain.
That is just so counterintuitive for us as humans. I mean,
Right.
We expect pain to look like crying or whining or, I don't know, completely withdrawing from the family.
Yeah, we look for obvious distress.
Right. If they're wagging their tail, our brains automatically tell us, oh, they feel fine.
Which is exactly why the text is so adamant about this. Pain assessment for this breed belongs strictly to the veterinarian.
Not the owner.
No, definitely not. It is not something you can accurately guess at home based on whether the dog still looks happy. The adrenaline and honestly just the endorphins of simply interacting with you, those can temporarily mask their pain entirely.
That makes total sense.
And this comes with a really vital warning from the source, too. Human pain medications should never, ever be used without explicit vet instruction.
Because canine physiology handles medication completely differently than we do, right?
Precisely. The mechanisms are completely different. I mean, an over-the-counter anti-inflammatory that, say, cures your headache.
Like ibuprofen or something.
Yeah, exactly. That can rapidly cause massive gastrointestinal ulcers or even acute kidney failure in a dog.
Wow.
You could do catastrophic damage trying to treat a pain you barely understand using tools designed for a completely different species.
Okay, so if they are these big, fluffy masters of disguise who hide their pain so well, how do we actually spot their struggles? And I guess once we spot them, how do we modify their environment without making them feel, useless?
Well, it starts by learning to read the subtle physical cues.
Yeah.
Since they won't vocalize their pain, you have to look at the mechanics of how they move.
Right, and the source actually gives a highly specific list of mobility red flags. It's not just some vague sense that they look tired.
No, it's very specific.
It's hesitation before going up the stairs. It's difficulty lying back down, not just getting up.
Yes, lying down is a perfect example of a hidden mechanical struggle. We always look at dogs struggling to rise, right? But lying down requires this controlled, eccentric muscle contraction to fight gravity.
Which is hard.
Exactly. When their core and their hindquarters weaken, lowering a 100-pound body to the floor smoothly, it becomes incredibly painful.
Ouch.
So they might circle endlessly, or they might suddenly drop the last few inches just because they can't hold their own weight anymore.
The text also points out limping, or stiffness right after they rest. And there is even this specific bunny hopping movement in the back legs. I mean, I always thought that was just a quirky way some dogs
And
run.
a lot of people think that, but it's actually a brilliant, albeit sad, mechanical compensation.
How so?
Well, when a dog has bilateral hip dysplasia or severe arthritis, moving one hind leg at a time requires putting 100% of the rear body weight on a single, really painful joint.
Oh, that sounds awful.
It is. So by bunny hopping, moving both back legs together, they can distribute that weight evenly across both hips. It's an entirely unconscious adjustment they make to minimize shooting pain.
Wow, so the bunny hop is literally a structural workaround.
Yes.
And the text notes, these signs aren't always just physical movement either. It can show up as, like, sudden irritability when they are touched in certain spots, or panting when they are completely at rest in a cool room. Sometimes it's just a change in where they choose to sleep.
Yeah, that's a big one. When they suddenly abandon their favorite spot on the couch or upstairs, it's rarely a change in preference. It means getting to that spot requires a physical toll they are just no longer willing to pay.
So once you start decoding these signs, the source moves into adapting the home. And the modifications recommended are brilliantly simple.
They really are. They aren't dramatic renovations or anything, but they do require the owner to compromise on their home's aesthetics for the sake of the dog's safety.
Right, so we were talking about adding non-slip rugs or yoga mats on hard floors so they don't lose their footing,
Yeah.
using ramps to help them into the car or onto furniture, blocking off steep stairs that have become genuinely unsafe for them,
Definitely.
and creating cooler resting areas because as they age, their heat tolerance drops significantly. Even something as simple as adding night lighting for failing vision.
Adding rugs is a really great example of the friction owners feel here. I mean, no one necessarily wants their beautiful hardwood floors covered in mismatched runners.
No, it doesn't look great.
But for a giant breed, slipping on hardwood isn't just embarrassing. Pulling a groin muscle or tearing a cruciate ligament because they couldn't get traction,
Yeah.
that is a life-altering injury for a senior dog.
Modifying the home like this, it isn't giving up or bubble wrapping your dog.
Yeah.
I like to think of it like building them a custom VIP lounge. You're giving them exclusive, easy access to the best parts of the house.
I love that. Viewing it as a VIP lounge completely shifts the mindset. It aligns perfectly with the core philosophy of the text, too.
Right, about dignity.
Yes, home adaptation is fundamentally about preserving dignity. You are empowering the dog with the chance to safely keep doing what it loves. Viewing these changes as a failure or as babying the dog, well, that completely misses the point. You are actually facilitating their independence.
Okay, here's where it gets really interesting. Once you have the home environment dialed in, you have to look at how you manage the dog's physical body. Which brings us to exercise. The source has this fantastic mantra for a senior dog. The goal shifts from performance to participation.
It's such a profound shift in how we view activity. Movement must be adapted, not eliminated entirely.
Right, you can't just stop.
No, if you just stop walking them because they are slow, their muscles will atrophy and their joints will stiffen even faster.
So you switch to shorter, more frequent sniffing walks. The mental stimulation of sniffing is incredibly valuable. For a dog, processing complex scents through their olfactory bulb requires a massive amount of neurological energy.
It's a real workout for them.
Yeah, it tires them out and enriches their brain without putting a heavy physical load on their joints. The real friction for the owner, though, is learning to stop the activity before the dog reaches exhaustion.
And judging that point of exhaustion is surprisingly difficult to gauge, largely because of one major, very fluffy obstacle.
The coat.
Thank you.
The famous Bernese thick double coat. That beautiful coat actually acts like a magician's cloak. It completely disguises the dog's true physical condition from the naked eye.
It really does. It hides dangerous weight gain, which puts terrible compounding strain on aging joints and ruins their mobility. And conversely, it hides muscle loss, which directly affects their ability to rise from the floor and navigate those stairs we talked about.
Right.
You look at the dog and you just see a big, familiar wall of fur. You simply cannot see the structural changes happening underneath.
Which means you absolutely cannot just eyeball their weight or their fitness.
No, you can't. And if we connect this to the bigger picture, this invisible physical reality directly dictates their nutrition. Because you cannot rely on your eyes, you must realize there is no one-size-fits-all senior diet you can just pick off a shelf.
You can't just buy a bag that says 7+ and assume it's doing the job. You have to physically get your hands on the dog. You have to part that fur, dig your fingers down to the skin, and feel for their ribs to check for a thin layer of fat.
Exactly.
If you just press on the coat, you're measuring hair, not body condition.
Right. Feeding has to match their actual body condition, their current activity level, and crucially, their dental comfort. The text strongly emphasizes that sudden appetite changes or unexplained weight loss should never be brushed off as, oh, they're just getting old.
Yeah, that's a dangerous assumption.
Those are massive red flags for underlying illness or severe dental pain.
So since we can't trust our eyes because of this magician's cloak of a coat, how we physically handle them has to become our primary diagnostic tool.
Yes, which completely transforms the purpose of grooming. Grooming is no longer just about keeping them looking pretty or, managing shedding. It acts as a full-body, tactile health scan.
But these grooming sessions need to change mechanically. They have to be shorter, gentler, and happen more frequently. You can't ask a senior dog with sore hips to stand on a hard grooming table for 2 hours straight.
No, that's just cruel at that point.
The friction there is real. You might have to groom them while they're lying down, adjusting yourself to their comfort rather than forcing them to stand for yours.
And during these short sessions, you are doing double duty. You are brushing the coat, yes, but you are actively checking for pressure points on their elbows, painful mats that pull the skin, paw problems, and unusual lump.
Feeling for changes.
Yeah, you are feeling for heat, swelling, or asymmetrical muscle loss that you cannot see.
I have to ask, though, with a breed that is historically so prone to cancer, doesn't searching for lumps during every single grooming session just turn into this anxiety-inducing nightmare for the owner? I mean, I feel like I'd just be white-knuckling the brush, absolutely terrified of what I might find hidden in the fur.
It's a very valid fear. But the source addresses this directly by advocating for calm vigilance. It reminds owners that not every lump is cancer, and not every tired day is a crisis.
Right.
Getting older involves benign fatty lumps called lipomas, and honestly, just naturally lazy days. The key is to look for new lumps that are rapidly growing or changing shape, unexplained weight loss, and severe lethargy.
So it's about looking for shifts in the baseline rather than panicking over the baseline itself.
Exactly. And while you are doing this physical scan, you cannot ignore the mouth. The source highlights how easily owners overlook dental care. You need to watch for bad breath, excessive drooling, or a dog that suddenly starts dropping its food while chewing.
Because the mechanics of chewing with a bad tooth are awful. If a dog has an infected root, biting down on hard kibble shoots pain straight into their jaw.
Right. It's excruciating.
They will literally spit the food out or swallow it whole just to avoid the pressure. Dental discomfort severely impacts a senior dog's quality of life.
Yeah, definitely. And to keep all this data straight, the lumps, the weight fluctuations, the eating habits, the source specifically recommends using the Vital Pet app.
Oh yeah, the app. It lets you track weight, signs of pain, sleep quality, and even just marking down which days were good days and which were hard days.
It's super helpful.
That way, when you go to the vet, you aren't just relying on your anxious memory, which is usually clouded by whatever happened that very morning. You have actual tracked patterns to show them.
And those patterns become incredibly important as we move from the physical body to the mind, because the most emotionally complex part of this journey happens when the dog's behavior or cognition begins to change.
Man, this part of the text really hit hard. Managing physical pain is tough, but behavioral shifts, they just feel so deeply personal. We're talking about signs of cognitive decline. Confusion, pacing the halls at night, staring off into space, or literally getting stuck in corners and not understanding how to put themselves in reverse to back out.
Yeah, they might develop newfound separation anxiety, becoming totally panicked when you leave the room, even if they've been fine alone for a decade. Or they might start house soiling, despite a lifetime of perfect potty training.
I found the best way to understand this is to imagine waking up in a strange hotel room in the pitch black. You don't know where the door is, you don't know where the bathroom is, the shadows look weird, the floor feels unfamiliar. It is terrifying.
It really is.
That sensory deprivation and disorientation is exactly what cognitive confusion feels like for the dog. So when they pace or have an accident in the house, it is absolutely not defiance. They are navigating sensory and cognitive changes. They simply don't have the capacity to understand.
Which means they require immense patience from you. They need strict routines so the world feels predictable again. They need gentle handling and deep emotional security. Reacting with frustration, that only compounds their terror and anxiety.
Yeah, you have to be their rock.
This raises an important question, though. With all of these physical and mental changes happening, and with owners trying to stay calm and not overreact to every slow day, how do you know when something crosses the line into a genuine medical emergency?
Right. And the source is very clear on drawing that line. There are non-negotiable emergencies where you don't wait to see how they feel in the morning, you just go to the vet immediately. These include sudden collapse, blue or pale gums, which mechanically indicates a severe lack of oxygen in the bloodstream, seizures, or severe sudden weakness.
And the absolute most critical one for a deep-chested giant breed is bloat, or GDV.
GDD. That stands for gastric dilatation volvulus, right?
Yes, and understanding the mechanism of GDV is vital to understanding why it's so lethal, so fast. What's actually happening mechanically is terrifying.
What happens?
Well, first, the stomach fills rapidly with gas or air, that is the dilatation part. Then the stomach physically twists over on its own axis, that's the volvulus.
Which effectively seals off both the entrance and the exit of the stomach.
It seals the stomach, but even worse, it twists the major blood vessels so blood can no longer flow freely back to the heart. The stomach tissue begins to die from a lack of oxygen within hours, and the dog goes into systemic shock.
Wow, that explains the symptoms so clearly. The text notes that unproductive retching, when the dog is violently trying to throw up but nothing comes out, that is a major red flag. Mechanically, they're trying to clear a blocked tube.
Exactly.
You'll also see a hard, distended abdomen and severe panicked restlessness because the pressure inside them is just unbearable.
And the source explicitly warns that bloat is always an emergency at every age. It is a mechanical failure, not a digestive upset. You must never assume an older dog with severe stomach discomfort is, just having indigestion or just acting their age.
So what does this all mean? We've looked at the house, the physical body, the mind, the true emergencies. How do we synthesize all of this into a philosophy for the end of our dog's life? The source frames quality of life as an ongoing dialogue. It shouldn't be a taboo topic that you only nervously bring up during a medical crisis.
No, it needs to be a regular, honest conversation with your vet about the dog's comfort, their hygiene, their ability to enjoy a simple, sunny spot on the rug. And it requires the owner to accept that aging is not a linear decline.
It has ups and downs.
Exactly. There will be good days where they act like a puppy and hard days where they need your physical help just to stand up.
The emotional climax of this text is just so beautiful. It notes that historically, the Bernese Mountain Dog was built to carry heavy weight on a farm. They had this physical, rugged purpose. But now, in its senior years, inside your home, it carries something different. It carries history.
It is a living piece of your family's memory. It was there when your kids were small or when you navigated major life changes. Dignity for this dog no longer means forcing it to work or perform.
Right.
Dignity looks like a non-slip rug, a slower walk where they get to sniff every single blade of grass, and an owner who actually notices what they need before they have to ask.
The goal is not to make the old dog young again, The goal is to let them be fully loved exactly as they are right now.
It's a profound shift from managing performance to nurturing presence.
It really is. Well, next time, we'll be doing a deep dive into the final part of this source material. We'll be looking at what it actually takes to bring the whole dog into everyday household life, covering space, managing the mess, and the real-world costs of keeping a giant breed happy and healthy.
It's going to be a very practical discussion.
Definitely. But before we go, I want to leave you with a thought. The source beautifully states that this dog becomes a living piece of your family's history, requiring us to adapt our homes and our hearts to their aging process. It makes you wonder, does our anxiety about our pets aging actually stem from our own deep-seated fears of getting older and losing our own independence? And if we can learn to care for a senior dog with this much grace, patience, and dignity, physically modifying our world to keep them comfortable, could it actually be the perfect training ground for how we should treat our aging human loved ones and eventually ourselves?